My father's name was Noel O'Sullivan. I was his primary carer, and in 2018 he started to display signs of dementia. My father entered a Cork nursing home in March of 2020. The nursing home went into lockdown immediately afterwards. My mother died on the 3rd of July 2020, and 3 days before that I took her for a window visit with my father at the nursing home. It was raining the same day and she sat on a chair, and my father was inside the window and couldn't understand why we couldn't come in out of the rain. My mum was 90 years of age at that stage. It was heartbreaking to see.
My mum had dementia and she was immobile. When she went to hospital, she was left for 28 hours in a COVID area. Following that, she was moved around the hospital on numerous occasions, and then she was sent to one of the private hospitals because they were sending more vulnerable people to private hospitals in order to protect them from COVID. But my mother hadn't been tested before she left the hospital, but when she got to the private facility, it transpired that she did have COVID, and we would have had a very traumatic experience with Mommy's care in the lead up to her death.
My mum's name was Alice Donovan. She did everything right. Then she was admitted on the 27th of December 2020. We spent 4.5 weeks without getting in to see her. I was frantic. I rang 3 or 4 times a day. They knew me by name at this stage, and I know they were really understaffed and overworked, and the nurses that did do a good job, I want to praise them people as well, because they did go above and beyond. But a lot of flaws and a lot of errors have happened to my mum.
Well, I think we said it'll be set up this year, and will be set up this year. The inquiry will certainly be up and running in 2024, and you can be sure of that. And
Minister, over 9,278 citizens have died from COVID. What is happening to the inquiry, which has been promised now for a long time? It's 4 years since we had our first deaths.
Last month you said you intend on holding an inquiry into the handling of COVID before the next general election, and that the terms of reference would be published within weeks. 1 month later, absolutely nothing.
As I did say within weeks, it's still within weeks, and I do intend to bring it to government shortly.
We all like things to be simple and easy and straightforward answers, and think there should be quick responses to everything. But some issues are very complex and have a lot of layers to them, and sometimes you do need a commission of inquiry to really dig into those issues. They've said it's not going to be a blame-focused inquiry, more an evaluation. I think the question is, how much evaluation do you need to do? So is it satisfactory that you just have a private meeting with somebody, a private interview, and get their personal perspective on how things were done and opinions on how things can be done better? Or do you need that person in a witness box on oath or on affirmation, cross-examined by a barrister to really get to the bottom of something? And sometimes you need that. The downside of an inquiry like that is that they take quite a lot of time, everyone gets lawyered up, they cost a lot of money. So the alternative to that is what they call a non-statutory inquiry. So it's not set up under any legislation, but all participation in that inquiry is on a voluntary basis. In other words, you don't have to become involved if you don't want to. You can simply decline to participate. And it also means that all of those legal protections, against defamation and things like that, they're not there. So it's a very different style of inquiry.
How Care Champions started was a rant. I went on Facebook after not having sleep for maybe 2 weeks, and I just ranted about how bad the healthcare service was, and loads of people messaged me. And within maybe 2 weeks we had 1,000 followers, and then very quickly COVID came. And we are now the biggest family-led grassroots support group from the COVID times. When the pandemic hit, after welcoming the initial restrictions for 2 weeks, as time went on, we started a campaign around window visits. Then it very quickly became about standards care. It also then became about trying to prevent the crises that happened in wave 1 from happening in wave 2 and 3 and 4, which it did, unfortunately. I think it is just appalling that today, in 2024, if there's an outbreak in nursing homes, we will have people standing at windows.
After my mum passed, I was told that she died with 2 staff members, and we're given the 2 staff members' names, one male, one female. So I kind of got a bit of consolation in that. And I was told on the 29th of May, 2022, that the Mercy can admit my mum died alone, after being told for weeks and weeks that she was with someone, and 2 people were with her when she died. It was a stab on the back and a stab in the heart. I suppose my grieving process started really on the 29th of May last year when I found that out, because they lied. We need a human rights-led public inquiry. We need a truth-telling process. If people don't know the story and my horrendous story, no lessons can be learned if the government don't know what happened to people.
I believe the policy and decision makers looked at people solely through a clinical medical lens. They saw people as a disease, they saw them as an age, they saw them as a condition. They didn't see them as human beings with rights and choices. And I think that was our big downfall. I believe that we need a human rights-led inquiry that will investigate what went wrong.
Some advocacy groups will say that a voluntary inquiry simply isn't good enough because you can't compel people to talk to the inquiry. So you might want certain nursing home operators to be involved, you might want certain hospitals to be involved, but if it's a voluntary inquiry, they can just say, look, we're not participating. I think different groups will have different goals. So certainly patient advocacy groups and next of kin who feel very aggrieved will perhaps want something different from government departments or the HSE who just want help to be able to plan better for the next one. But the messages we've got from government is not the blame game route, but the looking ahead route. So it's possible that not everybody will be happy when the terms of reference are published and they won't achieve everyone's objectives.
My father had 10 falls in total during his 7 months in the nursing home. My father's last fall occurred at 2 a.m. in the morning. My father had a broken hip, a broken wrist, and the pathologist's report was that he died from a traumatic brain injury. I believe he felt lonely, isolated. He must have been living in fear, not knowing what was happening to him. He was locked in and we were locked out. We have stood outside Dáil Éireann on 2 occasions requesting the government to listen to the lived experience that we have gone through. The loss that we have suffered because of the deaths of our loved ones under tragic circumstances is not good enough. We have an ageing population in this country and we badly need to protect people. And I would say to the COVID inquiry, we need safeguarding. We need mandatory reporting from staff who see things on the inside that we can't see from the outside.
We've seen in the past how certain things just don't go away. They keep coming back. If there's a strong enough advocacy group behind it, they can just keep pushing it. So just because it's non-statutory now doesn't mean in 5 years' time or 10 years' time, things change, which is probably the worst possible outcome because then you're doing the same job twice.